Dear students, in this lesson, we're going to carry on with the nurse's role in health promotion. Nursing is the largest of all healthcare professions. As far as traditional role of nurses are concerned, the focus was on a curative aspect, whereas expanded role of nurses assumed by virtue of education and experiences, and extended role includes the services to the people and community. It provides variety of services for the patients of all age groups, which may be part of hospital or community. It enhances clinical decision skills. It provides expert knowledge and high level of job satisfaction. Health is considered as fundamental right of individuals. Nurses have to carry out wide range of functions, especially in underserved areas like rural sector, remote regions, and urban areas. The transition of healthcare systems from a disease-oriented model to health-oriented model is an emerging trend, and this is what we call health promotion. There is need to expand nurses' role to face new challenges in providing comprehensive care to the patients. Advancement, for example, role of nurse within hospital and community will help them to become expert in patient care and achieving satisfaction. Thus, to meet the changing healthcare needs of the people, extended and expanded role of nurse is very essential. Let's take a look at the extended role of nursing. The concept of an extended role means to reach out. The role of a nurse in extended care facility is one that a nurse assumes by virtue of education, type of institution where she is employed. Nurses are performing different roles in variety of settings, for example, hospital or community, etc. It includes the advanced care to be provided to the patient during any major surgery or procedures focused on using various practical skills. As a community health nurse, it demands involvement of nurses in care of individuals, families, and groups which together constitute the total population. As a family nurse practitioner, he can assist the past and present physical and psychosocial health status of individual, provide health education and counseling, referral services for complicated cases, and the management of certain conditions. They can conduct survey and use research to extend nursing theory and to improve health practices among the community. Conduct classes for training of first aid to the workers to assist in emergencies. The occupational nurse has a very important role in industrial health programs. They participate in health education programs and research projects for desired change. As a rehabilitation nurse, he develops a therapeutic and supportive relationship with the patient and family. As a nurse practitioner, he provides healthcare services to the neglected, remote, or underserved areas. They provide treatment of minor ailments through standing order. They can provide a package of preventive, curative, and rehabilitative services for promotion, maintenance, and restoration of community health. They also can perform certain laboratory tests like hemoglobin estimation. Palliative or hospice care nurse means an agent which relieves but doesn't cure disease. A hospice is a system of family-centered care designed to make the terminally ill patient comfortable and to ensure satisfactory lifestyle through the terminal phase of illness. So hospice care does not care for the illness itself. It's not curable anymore. It is obvious. But the hospice services aims to give a quality of life until the death of the critically ill patient. So it is provided for cancer patients, including cardiac and renal patients at terminal stages. When we look at the expanded role of nurses, expanded role of nurse involves enhancing the nursing profession and responsibilities assumed by a nurse within the field of practice. In many countries of the world, lack of education is one of the causes of high mortality rate. Expanded role of nurse means engagement of nurse role within the boundaries of nurse. It is the responsibility assumed by a nurse within field of practice autonomy. So the focus of health promotion by nurses traditionally has been on disease prevention and changing the client behavior with respect to their health. In fact, the role as promoters of health by nurses is not as simple as we perceive. Health promotion has always been an essential component of nursing care, and the traditional approach has focused on screening for diseases such as cancer and on preventing communicable disease through immunizations. One of the nurse's roles is to share information and facilitate desired lifestyle behavior change rather than to prescribe or attempt to control client behavior. It is because they have experience and multidisciplinary knowledge of health promotion in their nursing practice. Moreover, nurses could practice health behaviors themselves. They could not only serve as role models, but also influence their attitudes, knowledge, and skills toward health promotion. Most of the quantitative studies reveal that nurses' role in health promotion are mostly in the prevention domain. As a role model, the nurses would be followed by their patient care. Their role can be benefit as well in community setting, like in supporting smoking cessation program. Nurses can play their role in cancer prevention, prevention of occupational hazards, building self-efficacy, and relapse prevention in patients, especially within the older age groups. Nurses play an important role as a primary care, whether in prevention or in the following the hospitalization. Nurses can be optimally delivering their services not only in the hospital, but also after their patients get back home. When nurses play their role as a counselor, they can give any advices such as lifestyle counseling in smoking cessation, like for patients with coronary heart disease. Let's take a look at the theoretical basis of health promotion, which consists of two major divisions. First one is health promotion orientation, which contains individual perspective, empowerment, social and healthy policy, community orientation. The second is public health orientation, which consists of disease prevention and authoritative approach. This slide summarizes the theoretical basis for health promotion for nurses. Health promotion orientation with individual perspective, empowerment, social and healthy policy, and community orientation, and public health orientation, disease prevention, and authoritative approach. And you can see the examples to the right of the slide. So if we look at the health promotion orientation, starting with the individual perspective, The most common factor influencing the concept of health promotion orientation is individual perspective. When nurses' health promotion activities were guided by individual perspective, nurses exhibited a holistic approach in their health promotion practice. They concentrated on activities such as helping individuals or families to make health decisions or supporting people in their engagement with health promotion activities. And empowerment. The second common defining concept of health promotion orientation is empowerment, which is related to collaboration with individuals, groups, and communities. Although empowerment is one of the most important theoretical bases for health promotion activities by nurses, empowerment was not embedded in nurses' health promotion activities until lately. And knowing this, or looking forward for a more powerful approach for the nurses, empowerment orientation has been implemented to nurses' activities since the concept of health promotion has been promoted. When we look at the social and healthy policies, nurses' health promotion activities should be based on the recommendations in, for example, the World Health Organization's charters and declarations, and directives and guidance from professional and governmental organizations. However, the studies examined found that nurses were not familiar with social and health policy documents, and that they did not apply them to their nursing practice. So you must be very careful, and you must be familiar of these charts, guidelines, documents, etc., put forward by who for your health promotion orientation. And community orientation. Nurses are expected to use health surveillance strategies, work collaboratively with other professionals and groups, and respect and interact with different cultures. A health promotion orientation appeared to result in nurses working more closely with members of communities, for example, being involved in voluntary work and implementation of protective and preventive health measures. Dedication in community orientation helps improve experience and contribution. Disease prevention. Public health-oriented chronic disease prevention and treatment has traditionally been the theoretical basis of nurses' health promotion activities. The first defining concept of public health orientation is disease prevention. This occurred in health promotion when the focus was on diagnosis, physical health, and the relief of the physical symptoms of disease. If we look at the authoritative approach, the second defining concept of public health orientation is the authoritative approach. This approach emphasizes the need for nurses to give information to patients. In addition, the authoritative approach suggests that health promotion activities should aim to change patients' behavior. Now let us take a look at the types of health promotion expertise that nurses have. Nurses implement a range of health promotion activity and apply different health promotion expertise across a wide range of nursing contexts. Depending on the context, nurses are able to make use of a variety of types of expertise in health promotion. Nurses can be classified into general health promoters, patient-focused health promoters, and project management health promoters. So this type of expertise, like the general promoters, patient-focused health promoters, and managers of health promotion projects, when we look at the general health promoters, health promotion by nurses is associated with common universal principles of nursing. The most common health promotion intervention used by nurses is health education. General health promoters are expected to have knowledge of health promotion, effective health promotion actions, national health and social care policies, and to have the ability to apply these to their nursing practice. The patient-focused health promoters, there is growing recognition that different patient groups, such as the elderly or families with chronic diseases, children, have different health promotion needs. In promoting the health of these different groups, nurses can be regarded as patient-focused health promoters. When health promotion for patient groups who need high levels of care and treatment is required, nurses must have the ability to include health promotion activities in their daily nursing practice. And managers of health promotion projects, nurses should be able to plan, implement, and evaluate health promotion interventions and projects. Projects can facilitate the development of health promotion in nursing practice. Thus, managers of health promotion projects should have advanced clinical skills and take the responsibility in supervising and leading research and development actions in nursing, as well as having the ability to coordinate educational and developmental interventions in healthcare units and communities. Now, if we look at the health promotion competencies that nurses exhibit, we see that there is a multidisciplinary knowledge, skill-related competence, competence with respect to attitudes, and personal characteristics. And when we look at multidisciplinary knowledge, nurses' health promotion activities are often based on a broad and multidisciplinary knowledge. This includes a knowledge of health in different age groups, epidemiology, and disease processes and health promotion theories. In addition, nurses need to have the ability to apply this knowledge to their health promotion activities. Nurses are also expected to be aware of economic, social, and cultural issues, social and health policies, and their influence on lifestyle and health behavior. Skill-related competence. Nurses must possess a variety of health promotion skills. Of these, communication skills were considered to be the most important. Nurses play a particularly important role when they encourage patients and their families to participate in decision-making related to treatment or to discuss and express their feelings about situations associated with serious illness. Skill-related competence also includes the ability to support behavioral changes in patients and the skill to respond to patients' attitudes and beliefs. In addition, skill-related competence involves teamwork, time management, information gathering, and interpretation, and the ability to search for information from different data sources. If we look at competence with respect to attitudes, competence with respect to attitudes emerged as a positive feature of health promotion. Effective health promotion practice requires nurses to adopt a proactive stance and act as an advocate. An affirmative and egalitarian attitude towards patients and their families, as well as the desire to promote their health and well-being, are important attitudes with respect to health promotion activities. Personal characteristics. Traditionally, nurses were perceived to be healthy role models, engaging in healthy activities, not smoking, and maintaining an ideal weight. In addition, personal confidence and flexibility are personal characteristics that nurses working in health promotion are expected to possess.